Bonjour, bonsoir, dear friends, and welcome to JCB Live. Today, for this amazing happy hour, it's going to be very educational. We are in the heart of San Francisco with an amazing man. He owns doctorate degrees, he's an assistant professor, he's done the best universities you can imagine, finished at Harvard Medical School with neurology. I first met him, very fortunately, a few months ago when, after many sessions of kickboxing, I go and feed the animals, I bend over, and suddenly my back is stuck. Can you imagine that happening to you? I call the best practice in San Francisco Dr. Sergio Azzolino. He has a fantastic touch. Ladies, just to warn you, he's very attractive. He looks like the Italian god. He's married with many children, but you could still come and see him at the practice because he touched my back and minutes later I was jogging again. So he is phenomenal. As I discovered his chiropractic practice, then I discovered his neurological background and all the things he does with the brain to understand, to prevent, to guide you, and to make you a more performing athlete, as he treats all the top athletes on the west coast of the US and beyond, as well as yourself in your process of life. So I'm excited. We're going to be surrounded with a lot of great machines. We're going to show you something we've never ever done. I'd like to tell you, you'll get all the information of Sergio. You could come to his practice, and he's a JCB collector, so you'll see him part of the events. He's going to grab the cork because his agility is amazing, and he could catch things faster than the speed of light. Boom! Here he is! Ladies and gentlemen, the famous Sergio Azzolino.
Thank you, John Charles.
Isn't it wonderful? The Italian and the French align around medicine.
Absolutely.
So how is it to be a first generation charming Italian moving to America?
Well, let's drop the charming off and let's focus on first generation here. I feel very blessed, very fortunate. As you know, parents of Italian descent came to the States here with little education, little ability to speak English, and came, and thank God for their foresight, because they wanted to provide myself and my other siblings an opportunity that only this country could offer.
And you came from the south of Italy, right?
Yes, they came over. I was born here, fortunately, and yes, it's a blessing because there are values, there are things that they have shared, and things that they saw as in regards to opportunities that this country has to offer that I'm very grateful.
That nowhere else we can find.
Exactly.
Well, let's do a cheer again because you didn't taste the wines. You look at me in the eye, so that's a good sign. You know the rule is 7 years of bad practice.
I understand.
So Sergio, quite amazing because you had such an incredible background. You were professional athletes. And
Professional musician.
Musician.
Not an athlete.
Well,
I gave up athletes for being an athlete.
Yeah, give us the background and how you came up to become, in the medical space.
Yeah, quite simply, I enjoyed a healthy and happy childhood with playing sports, playing music.
Yeah.
And it was after high school that I gave up playing sports. I had some scholarships, I had an opportunity to play football in college, but I gave that up for my passion for music. Had the good fortune of playing professionally for years and experiencing some great things in the world as a result of that, but some health challenges, as many of us face.
Yeah.
Thank God, nothing life-threatening, nothing to the magnitude that we deal with on a daily basis, but some health challenges made me start to look at life a lot differently, made me realize that unfortunately without your health you do not have a full life, and you do not have much if your health is in the way. And so I started prioritizing that, started looking at ways that I can improve upon things. I became very frustrated fairly quickly with the lack of curiosity in medicine and among many practitioners. And so that's what led me on a journey to seek more and more answers. And in doing so, I think I found my calling of spending my life turning around and helping others.
Well, before we obviously discuss that, tell us about all those talents combined. sports and music. Tell us a little more about the musical background, because this is a big deal. When you're an athlete, music, and then a great scholar. Maybe it all goes together.
I think they're all very similar in that no athlete would get on the field unless they're ready. No musician would get on stage unless they're ready. And fortunately, we have a teaching clinic here. And, you know, I speak to a lot of the young doctors that you need to, hold yourself to a level of excellence, especially in working with patients, that I think having that background was a good platform to hold myself to a high standard.
So what instrument did you play?
Well, as every young Italian boy should, I started with the accordion.
That's how he charmed all of you ladies, of course, at a young age. I know the trick.
Every French man should
drink
be a
wine.
winemaker. Every Italian boy should learn how to play the accordion. Moved on to the piano, moved on to the electric bass, played in rock bands for years.
And you still play today?
Not much.
Not as much?
Not much. I enjoy listening to the kids play.
Give us your past. So you go to medical school, you do chiropractic, and then you realize there's something more going on that you want to pursue.
I studied nutrition in my undergrad. I went to chiropractic school 30 years ago, not medical school. I completed a postdoctorate medical degree at Harvard Medical School in research.
Yes.
That was what you were mentioning. My background spans many different disciplines, from nutrition, chiropractic, to natural medicine, to that recent degree in research,
Yes.
and many postdoctorate degrees in neurology. So what I found out very early on is, if we're seeing changes,
Yes.
if you can smell and enjoy the wine,
Yes.
if you can taste the wine, if you understand, the very senses that you're a master at, then it's happening through your brain. It's happening in your brain. And so all movement, all parameters in the human body, every cell is controlled by the brain. All our organs are controlled by the brain. And so very early on, I found a passion for neurology to better understand how we could bring people to a higher level of function.
So today you're going to improve my tasting abilities, my smelling abilities, my balance, and all of the above, right?
Well, we could talk where they come from, talk about where they come from. I don't know if we're going to improve upon them. I want to commend you, first of all. I was looking at your book last night, and
Thank you.
The Alchemy of the Senses is a phenomenal book, and you captured so much of the essence of what our sensory system is in those few pages.
Well,
and that's spectacular.
Well, thank you, and we should talk about this, but we share a very unusual birthday with Sergio. All the boys and girls born in 1969 have a passion for space, right? And you were reminding me that you were born in a very unusual time when you think about space.
Well, it wasn't until I heard you mention so many times that you were born in 1969 when the men went to the moon. And I had to remind John Charles, or at least enlighten him, that I was born 16 minutes prior to them leaving for the moon. And I think you came a couple months later.
That's right. It took them a while to come back down. Well, to 1969. And I know we're drinking 21, although it's still a Burgundy, it's a Crémant, it's a Chardonnay Pinot.
It's delicious.
Give us your charming description, maybe using the brain.
Well, as you know, the first thing you want to do is look at the wine.
Mm-hmm.
And that not everybody sees the same. And so all of us have blind spots. We all have a blind spot in our eye where we have what we call receptors, where we have a lack of receptors.
Mm-hmm.
That eye then connects to a major part of our brain called the thalamus, which is a sensory organ in the middle of the brain.
It's in the middle.
It's in the middle. That's where all the sensory pathways go through.
Okay.
And I, was fortunate to be involved in a study with my mentor, great dear friend of mine, and one of the best, functional neurologists in the world, Professor Carrick, where over 25 years ago or so, we did a study showing that we all have blind spots.
Mm-hmm.
They could be much bigger on one side versus another, depending on the firing of those relays in the brain. Some people see color, some people have taste that's very different. And so part of what we do, and hopefully we'll get a chance to speak about, is assess where your sensory aspect is, where your brain is in regards to recognizing the world, and be able to hence enjoy some of the finer things in the world. Because to one person, they may not be able to appreciate this if they've had a head injury, if they've had a brain problem herself. So this is spectacular. I mean, you have some of the cleanest, the most fruitful, and yet the finest wines that I've tasted tonight.
Coming from Dr. Azzolino, we're very fortunate. This is a top recommendation, dear friends. And then, so we taste with our nose, we say a lot, don't we?
Yes.
At least I say that. So can you enlighten our friends who are with us today about
Sure.
what does that really mean?
Well, you say that, and you're very correct in saying so. All the science supports that the majority of taste is coming from our nose. We taste from here, first of all, or the majority of what we taste is coming from our smell here. And then when we're drinking, we actually have the aromas going up the back of our sinus passages and into our nose. If you plug your nose and you try to taste many wines or even many fruits, they are not going to be that special. They're going to be sweet or sour.
Interesting.
But it's so important to use the nose and also assess people's function, because we know that if we deal with a lot of issues that we deal with on a regular basis, like autistic children or children with neurobehavioral disorders, they can't smell. And as a result of them not being able to smell, they can't taste. And as a result of them not being able to taste, they have phobias around new foods.
And they taste the same food probably all the time.
They prefer the whites, the French fries, the pizza, the milk, and they're eating the same thing over and over again. Whereas as their brain starts to come back, we see some of the most spectacular changes in the world with children. And as we start to stimulate those parts of their brain that are not functioning well, that are not age appropriate, those parts of the brain start to wake up, and as do their senses.
So how do you stimulate all that?
Well, one of the most important things that we do is assess an individual to see where their strengths and weaknesses are.
Yes.
And with a very comprehensive neurologic examination, we test their sensory nerves, we test their motor nerves, we test their balance and coordination. We test all their different reflexes. With balance and coordination, we can show you, as you've seen, we could test exactly how they're standing, how far they can move. It's called the limit of stability. We look at eye tracking, and the eyes are an extension of the brain. We can look at the accuracy, the speed of your eye movements, the reaction time. We can test your vestibular reaction time, which has a lot to do with your balance and coordination. We could test your auditory reaction time. So much of how we navigate through the world is based on our senses. If you look at how a healthy individual navigates through the world versus someone that's had a stroke, someone that has some age-related decline, their movement patterns are markedly different. So we assess all those. This right here, right behind you, we could test your hand-eye reaction time. We can see the speed of your hand and eye reaction. And with all of these things, the goal is to assess where your strengths, where your weaknesses are, and then we could formulate a very customized rehabilitation program to maximize your function.
Maximize it and to
maximize.
So all of us, if we just continue on taste for a second before we do eye and all the coordination with all those great equipments, can you improve someone's sensory acuteness and ability?
With taste, absolutely. Absolutely. There are simple nutritional...
Pretty cool, dear friends. This is the future.
And this is what we need to talk about, doing some hard research.
Yes.
Let's bring the science into it.
Absolutely.
And we could do some great research, because there are simple nutritional deficiencies that affect people's taste. But what we see a lot of, and I've been blessed with the nose and some martial arts.
The Roman nose, you know. The Roman gods, the Roman nose.
Yes. But nonetheless, one area that we see a great deal of pathology is simply in the nose, in the sinuses. We swab people's noses all the time. There are toxins people can be exposed to, from mold toxins to a variety of different toxins and bacteria that can grow and actually colonize the nasal passages. So we do swabs, we identify, we culture these things to see what people have, what normal flora they have. Normal flora is the normal bacteria we should all have. The majority of our body is made up of bacteria. The majority of our immune system is the bacteria that we have from our mouth, our nasal passages, all the way down through our gastrointestinal system.
I see.
And with certain medications, with certain lifestyle, we can change the normal flora and get unfavorable things, from yeast to mold toxins to different bacteria. If we identify these, just like with everything else, we treat it.
That's right.
And in treating that, we can clear out the nasal passages. We could drastically improve people's taste. We test for toxic metals. Toxic metals affect
That's
people's
another
smell
big one.
and taste. And as I said, with autistic children, to people with head injuries, which are extremely common, to even conditions like Parkinson's and Alzheimer's, unfortunately, people start to notice a decline in smell. So you can do a lot of good in the world by just simply getting some objective metrics on people's smell, taste, and allowing them to identify that and enhance that.
Can you imagine, dear friends, what we're about to unveil at some stage in the no distant future? It's going to be exciting. So what do you recommend for people who are listening with us to come to the Azzolino practice, of course, in San Francisco, on magnificent Broadway Avenue, and to get started with assessing themselves, right?
Well, the great benefit of being assessed is you will have a much better understanding of how your body functions.
That's right.
All of us have a brain that's coordinating all of the different functions in our body. And if you get some objective metrics on where you're at, you could always do something to improve upon that function. Now, there's people that are very healthy that say, I just want to know where things are at. I don't want to address anything. And that's fine also. But the benefit of understanding the speed of your eye movements, the hand-eye reaction time, your balance and coordination, is you get to make an educated decision on, is it something you want to improve now, or do you want to wait? One of my great passions is helping people live their life to the fullest.
That's right.
And unfortunately, all of us in this age group know too many people that have started
young
to,
age group?
Yes, have started to decrease their desires in the world, or are not living their passion because of health-related challenges. The sooner you address these things, the better off you will be.
So you come here for global assessment that, by the way, we're going to show you because we're going to do it in front of you. And it's going to be very exciting. I'm going to be the one being assessed. There's so many things to improve that I'm going to be holding myself accountable, thanks to Dr. Azzolino, of course, who pushed me to be accountable. But I think it's very important. Comes a stage in life we want to improve ourselves. And we want to stop looking at a curve that is eventually declining. So we could certainly somehow correct it a little bit, right?
The decline begins a lot sooner than people think.
Yes.
And it doesn't need to.
How old do you think?
Well, we know that biologically things start to decline at the age of 25. And we're blessed here to have patients from right now, a lady in her late 90s, 98 years of age, all the way down to many newborns and many people in between.
That's right.
If you are working on your weaknesses, if you're working on your deficits, you could always significantly improve your function. And the idea is to intersect that decline, to stop it before it occurs.
So we're going to work on all our senses, and you work as well on mobility, on movements.
Absolutely.
All of the above, right?
Yes.
All those machines.
And we have a lab here that we can assess specifically what's happening with your blood. We could test a variety of different things, from toxins in your blood to your amino acids to your essential fatty acids to a host of different functions that are extremely important. With all those things, once again, there's always some objective measure and some meaningful change that can happen.
Well, talking about meaningful change, Dr. Azzolino, before we get started, I just read a study coming out of Korea. Maybe you finished that last sip. We're going to drink the Raymond Napa Valley Chardonnay. The study says that if you have white wine and cheese, it improves your cardiovascular. Could that be true?
Well, is it so much the wine? Is it so much the cheese? We don't know. I haven't read the study, but certainly we know that there's great benefits in wine. Resveratrol and many of the other antioxidants that you know. There's some people that are not a fan of eating cheese. It's genetically in your blood, and I would caution you before you give up cheese. We can.
I've never thought of doing that, did I?
We can test to see if you have a food sensitivity to cheese.
Yes.
And you and I, our metabolism may respond differently to wine than the average individual.
Well, and wine for you was at the dinner table all the time, right? How did you enjoy it with your family?
I was raised with wine not being an alcoholic beverage. Wine was very much, an accompaniment to dinner. It was a flavor enhancer. We didn't use MSG. We used wine.
Flavor enhancer.
Yes, and so I was raised having wine at the table. My father, my uncles, my grandfathers, they all made wine.
Yes.
And not to the
In
level
the
that you're
house.
making it.
Well,
They
in
were
their own,
immigrants. They
which
were
is
making it
great.
so they didn't have to buy it. If
For
they
sure.
knew the cost of these things here, they'd be rolling over in their grave. But I think they also never developed a refined palate. And on the same level, wine was something that was always on the table. It was never a matter of drinking to get drunk. It was
That's
a matter
right.
of drinking a small amount.
And I
to
think
enjoy.
that's very important. And I got to tell you, as we discussed before, doctors in general and the medical field is great with wine and the wine world because you understand it so well as a contribution to human health rather than just a threat. And I think you treat it as such, which I love. So cheers to that. Hey, tell us what you think about this Napa Chardonnay before you put me through the drill, because I'm sweating of excitement and anxiety. I've got to go through the neurological process with Assistant Professor Azzolino.
What I love about your Chardonnays, first of all, is they're not too heavy on the buttery side, and it has a very
Thank
clean
you.
finish. My wife is not a Chardonnay drinker until she had your Chardonnays.
Oh,
She
good.
says, "Wow,
Fantastic. Well, coming
this
from her.
is different.
Yes.
This is different."
Well, there she is watching, so we send her a big kiss, or at least I do.
Yes.
And my wife sends you a big kiss.
Oh, well, thank you.
But thank you for that. So, Sergio, what shall we start with? Because I think it would be great for all our friends. We have many phenomenal questions for you, of course, all along the way. But to really discover how far you've pushed it in terms of research and development for all of us and
Sure.
improvement. Because I need to tell you, dear friends, I came a few times here and I'm blown away. And the goal of today is for you to discover Dr. Azzolino, his state of mind, and of course what you should maybe thinking of doing at certain stage in your life to assess and then guide yourself to a new stage if you wish to.
Absolutely, and you're a great example of that because you've refined your palate, you refined your senses more than
But
most people have.
I'd love to continue to do this, and I look forward to today very much, and for you as well to further stimulate some of my senses, because we get in many ways very static in our evolution as individuals. We have a normal practice, a normal way of assessing wine or making
Sure.
wine, and it's often quite repetitive. Do I push myself enough? The most valuable asset I have is my nose. I've always said that because I've always tasted wine like this, not
Yes.
even putting my mouth in it, often. Similar to fragrance, similar to, all the things we do. So I really look forward at the end of this session for you to guide me as far as how can I improve my sensory.
Yes, we need to have a better understanding of how your sensory system is doing. And most people never test that in their life. They only experience it when it's declining. And some of that may have happened because there was nothing meaningful that could happen therapeutically.
Yes.
Now we have the technology. We have the technology to not only assess but to meaningfully introduce different modalities, which we'll explore, that can make a world of difference in your brain-based performance. And all of us can benefit from that, and there's no reason to let the body decline.
Let's go to the brain. Are we ready?
We're ready.
It looks like I'm going to go scuba diving, but I think we're going to see a lot of things. So you put a lovely mask on me.
Sure. So this is what we call a video nystagmography or video oculography. This is an infrared camera in here that's going to pick up your eye movements. And so what we're going to do is cover you up here, and we're going to be able to assess your eye movements on the screen here.
I cannot wait. Are you going to
Do you want one last smile for the camera?
Are you going to put some lovely images going through the
No,
screen?
we're going to test specifically your eye reaction time and the speed of your eye movements and whatnot, and we'll show you that. In just
And
a
what
moment
is it
here.
going to tell us at the end of the day?
Once again, your eyes are a product of your brain.
Yes.
It's not your eyes so much that we're assessing. It's the relay centers in the brain that coordinate the eye movements.
I see.
And when you're looking smoothly at something, we're activating one part of the brain. When your eyes are reacting quickly to different targets, we're testing another part of the brain. And so this is just another way that we can get a full assessment of how various different relay centers of the brain are doing. And then we'll put we could do an EEG where we put a skull cap on you and test the different frequencies in various parts of the brain also.
Ooh, very exciting.
All of this is just going to give us a good picture on how this spectacular brain of John Charles is working.
And no secret. All the faults, you'll know them all. So now the moment of truth.
Now's the moment of truth. And so we know you have a spectacular and vivacious, and I mean, your brain is different than most. You know that.
I did not. But thank you for telling me that. That's not a good sign.
No, it's a great sign. And now we're able to see a variety of different things. On this here, we're looking at what we call your smooth pursuits.
Okay.
And how your eyes are tracking. And so we have one line that is very specific to the norm, and then we're looking at your eyes moving along here. And we see that you have a little deficit looking to your right than to your left.
Yes.
All of which, is important, especially, are you continuing to do your martial arts?
Yes,
your
I am.
kickboxing?
Absolutely.
Yes, so I wouldn't let anybody that you're sparring with see this data because they will know where your weakness is.
Yes, but I could see it from the right side.
Yes.
Is it what you're saying here?
Yes. And
It's true if something, even in tennis. So do you work with a lot of big athletes as well as tennis,
and
professional?
Absolutely, professional shooters and whatnot.
Yeah.
So this allows us to see exactly where your deficit is. So let me fast forward here a bit to, we're going to look at something here called your saccades, which this column here is assessing the velocity, the speed of your eye movements.
Yes.
And this also looks at the accuracy of your eye movements. And your accuracy is between 89 and 92%. For a winemaker, that's just fine.
Yeah.
For a professional shooter, you would be looking for a job.
Yeah.
Okay.
I imagine.
This looks at your reaction time, and your reaction time is superior. It should
still
optimally be below 200 milliseconds.
Okay.
And you're between 173 milliseconds to your right.
Yes.
And 194 milliseconds here looking to your left.
Yes.
So there is a gap. There is a deficit. If you were a professional baseball player, we'd know where to throw the pitches at you.
That's right.
If you're a professional boxer, people know where your weakness is because of this. And all this can change. When we move into the other room, I'm going to show you how we take this information and we specifically put targets up on the screen, firing at a little different frequency from one side to the other, and force you to react to them.
I love it. So how do we actually improve those numbers?
With actually activating those targets and doing exercises.
Yes. And could it come on my right side because of some hearing deficiencies that I may have happened?
Absolutely, because all sensory modalities compensate for each other.
Yes.
So when we look at your balance, if your hearing and this vestibular nerve is a little decreased, you may compensate by being a little more visually dependent.
That's right.
Okay?
See.
And the beauty of life, the beauty of humankind is that our brain is constantly adapting to the environment. And as we adapt to the environment, if all of our senses are working well, if all of our different faculties are working well, we're going to be able to compensate. So most of us go throughout life with areas of weakness.
Yes.
And we compensate for them. Our goal is to have you have a dual life. You can compensate and function at the high level that John Charles does in the world.
Yes.
And continue to do so. But you get to come here and we see where we can improve your function a bit.
And you know what it's demonstrating, dear friends, is the fact that I've noticed this, and my speed coming from the right side, it could be, boxing, it could be tennis, it could be soccer, it could be talking to someone. I know from that side I'm a little slower than I am from the other side.
Sure.
And so I look forward to hopefully correcting this.
When we look at this here, this is called your vestibular ocular response, how your brain is responding to movement. When we cover you up like we did, your eyes are going to react to doing what they do right now.
Well, I was expecting some other feelings maybe, but Ooh la la. It was all about texture for a while.
Yes. And you could see that your eyes are beating back and forth. This tells us how you're processing movement in one direction versus another. When you're kickboxing,
Yeah.
your kicks may be a little faster turning in one direction than another.
Absolutely.
Now, to you, this is the creme de la creme.
Yes.
To an individual that's had a stroke, that's had a head injury, to an autistic child, they may not be able to turn a particular way. To an elderly individual, they may notice that I can't turn to the left, I stumble and I fall. And that's very significant. And so, once again, it would be spectacular if there was fewer sick people in the world and we could just focus on people like yourself that want to bring things to a higher level. But given the deficits that we're seeing out there, we must spend our time bringing up people's functions.
But that's exciting that you're working with all that full range of people to really improve everything that they do.
It's spectacular. It's a blessing because we're able to do so much. If we look at the brain from a functional perspective, I've been doing this 26 years.
Yeah.
So 26 years ago, if we told you we could change your brain function, people doubted it. Nobody will doubt it today. Your brain function can change because if you do things to stimulate the vestibular system, if you do things to stimulate the visual and the ocular motor system, which is the eye movements, if we do things with your hand-eye reaction time and your coordination, have you focus on your balance, we can greatly improve function in each and every individual. And it's life-changing for many.
It is life-changing, absolutely. And specifically for the people you've mentioned who will see an enormous evolution, which I'm sure you've noticed with many patients.
Absolutely, absolutely. And doing this for so long, I've seen kids that we treated that were autistic that now, they would sit in a corner and scream and cry and cover their ears up and their eyes up because they're having sensory overload and parents can't enjoy a normal life to them being college graduates now.
Wow.
And functioning like normal people in life. It's extremely
Is
rewarding.
it one of the most fulfilling part of what you do?
Absolutely, absolutely. Because as much as it's sexy and it's exciting to work with world-class athletes and performers and Olympians, it's spectacular. I wouldn't want to give that up.
Yeah.
But a millisecond to them may mean the difference between being on the podium and not.
Yeah.
And whereas with a child and a family that can't bring their child into public and bring them to a beautiful dinner or something of the sort, that is significant and very life-changing. And
That's right.
It's one of the most passionate things that
Well, congratulations
I love.
for having both sides of your heart. One, the performance, and the other one, the elevation of any individual. Congratulations.
Okay, John Charles, this is an individual that unfortunately he was a world-class rodeo rider and had a severe brain injury. And so here we can see his ability to read is very limited. So unfortunately, and we see this with elderly individuals, we see it with, once again, children with learning disabilities or a head injury. When people can't read, they think doing more of the same thing will make them better. And it's not the case.
I see.
If you don't know how to taste wine because your nose is not smelling it, drinking more wine doesn't make you better.
That's right.
Having an education on how to do it or addressing the underlying physiological problem may make the world a difference.
That's right.
And when we look at this here and we look at his ability to read, this is what his eyes are doing as he reads this passage. And you'll see...
So they're missing the words.
It's very slow. And unfortunately, this is in live time. It's very slow and he gets stuck. These are what we call regressions. And this is brain processing.
Wow.
Tasting wine is brain processing.
That's right.
Okay? It's certain parts of the brain we know process smell and taste.
That's right.
Process the texture and all of that, which is so important. So in a situation like this, not only do we see some significant deficits, but we're able to track that his comprehension is 60 of 70. That's not bad.
Mm-hmm.
But his reading words per minute are 48 words per minute, and they should be at his grade level 195.
Wow.
So when
there's a lot of improvement to be had. So how do you get there?
So this is a perfect example of once we have this data, then we know what parts of the brain are deficient.
Yes.
And then we know how to give specific exercises for that part of the brain.
Oh, congratulations.
You don't.
This is amazing.
Yes, you don't hire a tutor here and say, make the kid read more.
Yeah. There's no way.
That's not going to happen.
That's fantastic. Wow. Sergio, it's very rare for me, but I'm speechless. This is brilliant. Thank you so much for sharing that. This is phenomenal.
So this is just a sampling of many of the different tests that
Yeah.
we can do. We test cognitive function also. As I said, we could do something called a neurocatch, which looks at some different pathways in the brain to look at how you're processing sound
Yes.
and cognition and whatnot. So all of these are very integral to see how you specifically perform so that we know what to do to
This
get you
is
to that
brilliant.
next level.
So what shall we do next?
Well, let me show you your balance test here. So what we're going to do here, John Charles, you need to move to that target as quickly as possible, okay?
I had to do the removal of the shoes, but dear friends, as you can see, the red socks are obviously still on. Very important to help my stability at all time. So now I go from here to the front.
target.
Oh, to the target.
To the target.
Ooh,
And back forth.
I'm there. I got it. I got it.
You need to move smoothly.
You see?
Actually, with your entire body. You're not dancing here.
Oh, I see. I was trying
From
to,
your waist.
to show you a Michael Jackson move, but, you know. It's tricky. You got the whole body.
All right, John Charles. So we just did your balance test.
Yep.
You did very well.
Oh, thank you.
You did better than the average. And
I was kind of struggling on a few sides again.
we'll show you that in just a moment. On this test here, this is called a modified interaction of your sensory
Yes.
balance. Okay? This is what we call your center of gravity, COG. This shows where you're standing with the 4 different activities we had you do.
Yes.
Gray is the age norm.
Mm-hmm.
You should score better than your age norm given your athletic abilities.
Which I'm not.
You are scoring better than your age norm on this. This is your eyes open, you
Yes.
scored better. Your eyes closed, you scored better than the age norm. This is how far you sway.
Uh-huh.
This is your eyes opened on a
So
foam
maybe I do
surface.
things better when my eyes are closed. Maybe I should start to taste
I will
wine.
show you in just a
Eyes
moment
closed?
here. So you did well on this test, but when we look at what we call your limit of stability, this is your movement pattern. And rather than looking like a sophisticated Frenchman, you're looking like a drunk Irishman.
Yeah. This is very true. This is how I move my hips.
Yes, so this would be similar to what we see people do when they walk out of a pub.
Wow.
Rather than
And
moving
dear friends,
to
we only
targets.
had a little bit of JCB 21 and a tiny bit of Raymond Chardonnay. So what's happening here?
So from the center point here, you're moving to each target.
Yeah.
And you can see very circuitous route here, especially coming back into your right.
Yes.
This is your weakness.
Mm-hmm.
This is looking at your reaction time. And your reaction time should be at 1.0. You're scoring 1.4. Very common thing that happens with age. If you played sports,
Yeah.
you played tennis, you played soccer,
Yes.
you know exactly what the hand and the foot is supposed to do.
Yes.
Your brain knows what to do, but the firing from here to here may be a bit delayed.
That's right.
And that's what this shows. This shows when we tell you to move to the targets, it's a bit delayed. It's only 0.4 seconds delayed, but nonetheless, that can be very significant. If your balance is not so good and you start to have a delay, it increases your probability of a fall.
That's right.
And we can change this. We
And-
change this by forcing you to move
And
to
as we
targets.
get older, the fall is tragic in many ways.
It's one of the 4th leading causes of death, unfortunately.
4th leading.
4th leading cause of death. We know that
Wow.
heart disease is the #1 among men. Okay?
So we can
But-
prevent it by doing those tests.
We can
eventually.
absolutely prevent it. We can see when someone's balance starts to decline.
Yeah.
And not only will they have a recognition of that, but you can have some interventions, some very meaningful interventions that can make a world of difference. We can show you thousands of pre and post that within several sessions, their balance is appropriate
Yeah.
because you're doing things that are very targeted for that individual.
That's brilliant.
There's no point in having Steph Curry or another top performing athlete do certain dribbling exercises if they're a master at that.
Yes.
But all of us can get assessed at this level, identify where the weakness is, the areas for improvement, and address that.
And the sway velocity?
The sway velocity is good. Your distance to the targets was good. You were able to hit the distance, but you see it's a very circuitous path. And after we work with you for a couple sessions, you're going to see this clear up, and it's going to be a very direct
Well,
target.
luckily it's St. Patrick's Day in a few days, so if I'm a drunken Irish, I will fit right in. So now it's Dr. Sergio because Dr. Azzolino is becoming way too serious. Tell us though, how many practices is there like this in the world? Because the crossover seems to be amazing of all the activities we could do within this amazing practice.
Yeah, we have, I would say, a handful of high-level functional neurology clinics, maybe 5 worldwide.
5 in the world?
Yes, we have many that don't have the same level of expertise and experience, but we have a bright crew of individuals throughout the world that are able to serve people on this level. I think the one area that makes us extremely unique is the crossover. And the crossover of practicing medicine,
Yes.
practicing naturopathy, having an entire IV clinic where we're
Which you
assessing,
do as well here.
We do here. We assess for neuroimmunological disorders. We interact. We have a lab that's very active each and every day. We can infuse nutrients specific to your needs, and focusing on the brain-based functional aspects there. So there are naturopathic clinics and functional medicine clinics that focus on that aspect. There are neurology clinics. Limited, but we have those that focus on the functional neurologic disorders. So
but you brought everything into one place.
I brought everything into one place because you can't really determine what each individual needs.
For sure.
And I pride ourselves in examining an individual, identifying what they need, and then addressing those needs.
Yes.
All too often you go to a clinic where they specialize and they hyper-focus on one area, and you go to that clinic, you're going to get that. I go to a winery and they may serve one wine.
That's right.
John Charles doesn't do that.
No, we try not to. But which is amazing is you can address every one of them. And the difficult part in the medical field is to have to go to 10 places to address 10 different things.
Well,
and here, in one place, we can do it all.
All too often, people spend years in seeing 10 to 20 doctors trying to put the pieces of the puzzle together. And we don't do everything, but we do examine you and determine what you need, and we'll refer out. And we have a very healthy working relationship with many of the institutions around, from UCSF to Stanford to many of the top physicians around that can address your particular needs. But the most important thing is really to undergo a full evaluation so we can see what are your greatest health challenges. And when you have multiple different specialties, you're able to honestly and objectively serve those people's needs without having a bias of what I do is best or what you do is best.
That's brilliant. Congratulations for thinking so much forward, having the vision to do that and helping all of us to improve. This is so exciting.
So right now what we're going to do here is we're going to use this fabulous piece of machinery called a D2, Dynavision D2. We know where John Charles' little bit of weakness is in regards to his visual fields. We're going to test his hand-eye reaction time and then challenge him to get a little faster in that slower visual field. Otherwise, I'm going to come spar with you.
Absolutely. But he's done martial arts, so I'm in trouble. So I just move on the light? Is it what it is?
Yes, sir. Hit as many lights as you can.
Wow, perfect. Maybe I need a little glass of Raymond Cabernet. Not that I should. It's not for everyone to necessarily do.
Let's go ahead and hit some red lights.
All right.
It's testing your speed. Hit him.
Oh, I push it. Okay. Yes! We're loving it! It's very exciting. I'm sweating. All right. I think we got the feel, right?
Okay, Jean Charles, so what we can see here
Yes.
is your reaction time is 88 seconds up here.
Yes.
In the upper left-hand corner. Down here it's 1.2 seconds.
Yes.
So a marked difference, similar to what we saw
Yes.
in regards to
The
your
right
eye
side
reaction
again.
time. Yes. And so if you're a little slower there, we're going to give you some specific targets to speed that up. But at the same time, we're going to do some brain-based stimulation
I think I need
up
it.
in some of these relays of your brain.
You may find me a different person very soon. My brain will be more stimulated.
So push on your left, pull on the right. Now we stopped it here. Hold on.
God.
Let me give you something.
This is
easier.
a tough one.
Let me give you something
So
easier.
I push here.
Let me give you something easier.
Yeah, show me.
No, stay there.
Okay.
1 foot forward like this,
Yeah.
1 back,
Okay.
and you're just going to push on both. You can put your hands like
Okay.
this. You can push on
Something
both.
I could do.
So wait 1 second, Dylan. We're going to set the parameters first.
This
so,
is really tough.
So push.
Yeah.
Okay, not so hard because you're going to have to maintain your balance. So we're going to drop that.
But I push with my arm?
Now,
or-
now put your hands here.
But I
You're gonna
push the
pull,
machine.
Pull. It's got sensors in here that's picking up your movement. You see that?
Yeah.
You see the numbers?
Yeah.
All right. Now the exercise is going to begin. Okay, put your hands back up here.
Yeah.
Now the exercise is pushing. You want to get the bullseye. Okay? So you want to get the
Oh,
bullseye.
here we go.
But you got to get the bullseye. You got to fire both sides evenly and equally.
It is impossible.
It's not impossible.
I'm the toreadore. Woo-hoo-hoo.
Nice and subtle.
Yeah. I'm all about subtlety, obviously.
In most things in life.
God, this is so complicated.
You're looking like a man that drinks out of a bottle.
I'm still the drinking Irishman. This is a tough one. So let's look at Sergio. He's going to hit the bullseye.
It's just the subtlety of just keeping your core stable.
See, he's getting
and
it.
pushing it. Just
God.
nice and easy. And then you got to maintain your balance all at the same time. So it's working the brain in regards to it firing down to recruiting your muscles evenly,
Yeah.
and also maintaining your stability. Because as we go throughout life, we're oftentimes challenged with movement while we have to maintain our balance.
Well, you're staying in the bullseye.
Yes, that's what
Very
a professional does.
Wow. So I haven't touched the bullseye, dear friends. So I haven't even been in there. I don't even know the feeling of the bullseye.
So, spectacular thing for you. It would be foolish for us to spend any time trying to improve your sense of smell or taste.
Yes.
You have that refined. You've developed what we call plastic changes in your brain.
Okay.
Because you've been doing this since a young age,
Mm-hmm.
and your beautiful history there in that book is
Yes.
very
Thank you.
telling. Since you've been doing this since a young age, your nerves have grown. They have grown, they have rewired, they have become very efficient. Just like if we stop riding a bike, we always know how to ride a bike.
Yes.
Those parts of your brain are what we call plasticized.
Okay.
They've become more efficient. So you can pick up the subtleties. You could smell something and
Yes.
determine right away,
That I can.
where most of us would not be able to.
Mm-hmm.
So for you, if we want to design the second half of your life here,
Sure.
we need to work on the things that you haven't been spending as much time
Absolutely.
on.
Let's
We
do
need,
it.
we need to address these deficits, because when you can't see down into your right as well, it may not be significant to you now. It may be significant if you're sparring.
For sure.
But it's going to become very significant as your balance declines and you can't see down to your right,
For
because
sure.
you're going to trip on something. You're
Yeah.
going to fall on something.
Prevention.
If your coordination is not as good here, when you move,
Yes.
going to feed the goats may become a devastating thing to you, because
I get stuck.
as you bend, your brain is not firing these muscles.
That's right.
And if they're not firing the muscles, you're going to sprain the joint.
Makes so
So
much sense.
one may look at this and say, "Oh, you had a back problem."
Yes.
It wasn't just a back problem.
Yeah.
What happened to the back was secondary to these relay centers in the brain not firing quickly enough to fire these
That's
muscles
brilliant.
to stabilize you.
Oh, thank you for
So you may
such
recall
enlightenment.
that day we did some things in your ear. We put a
Yes.
little electric stimulation in your ear
That's true.
to stimulate those pathways. We did some things with movement to get the joints moving, but all of which this here will just help to maximize your system and bring you up to a higher level of function.
Oh, thank you for helping us to discover this. And very true. My back, in about 2.5 days, I was back flipping again, which was amazing. And a lot of the exercise we did had nothing to do per se with the back.
No.
And that's the beauty of the discovery.
So we don't learn by doing one thing.
Or,
Yes.
You don't learn a new language
right.
by just doing one
First.
thing. And so here, if we have a memory problem, these words will pop up on the screen and we have to hit them in reverse sequence, for instance. And we could put these in the field of space that's weaker for you.
Yes.
We could have them pop up and disappear at a particular time frame so that we're constantly challenging the brain. It's immersion.
That's amazing. So
Okay.
this is going to improve our memory.
Well, yes, we can control very specifically exactly how we program this, from having words at different levels to numbers to having it in the center of the field in larger field. We could do it in reverse. We could put these numbers over in one area or another. So once again, the key is the customization. We don't just let people loose on this and just doing things randomly. It would
So
be
you
worthless.
treat one specific issue.
We need to, and that's one specific issue. We need to know exactly what's taking place with John Charles if we want to maximize his function. If we want to just waste your time and have you do a bunch of fun little things, we can do that, but that's not going to happen. So we need to know where your weakness is, give you some very targeted exercises, and that will produce a change. Because your brain is constantly receiving information from the environment, constantly adapting to those changes, and when you stimulate a pathway over and over, it starts to grow, it starts to become more efficient, and that's what learning is. Whether it's tasting wine to doing something more complex. So I need to spend more time with you tasting wine, you need to spend more time with me maximizing brain function.
Deal.
So what we're going to do here with John Charles is he's had a little bit of a deficit in his right ear for many years that we just discovered. And so we're going to put him in this machine and it's going to spin him specifically to the right. Let's do a right cerebellar of 3.
I lost my glass of wine.
But we build you up on this here.
Yes.
We build you up so we get you to a point to where you can tolerate all that and there's no problem.
Yes.
I mean, a person with a head injury can't tolerate this. The world is moving too much around them.
I see.
But we can get you to a point to where, especially with athletes, we spin you all around and whatnot, and you do just fine. Because you learn how to provide stability and dampen that input. An individual that gets sick in a car sick, you have 2 people in the car, one person's getting car sick because they're not in control of the wheel and they feel like they're moving much more. The other person's driving so they could dampen the sensory input. Does that make sense?
Total sense.
Okay?
Yeah.
And when somebody's getting car sickness, it's just that they're getting an overreaction to their vestibular system.
Yes.
Whereas we could put you in here and we could break that in a couple visits.
Wow. This is incredible.
Because we just train your brain to unwind it. So do it 14.
You train the brains to understand the movements.
To understand the movement and to compensate for it.
To compensate.
Okay?
Yeah. I get that, yeah.
Shall we unwind?
Yes.
Okay, I'm ready for more. Give me more, baby. I'm loving it. I have a feeling I'm at the Gold Club on the full bar. Fascinating. I gotta say, unbelievable. This balance is crazy.
So balance
It's
is once
very
again,
difficult.
balance is a product of input from your eyes, from your inner ear, and from your joints and muscles. So all too often, if somebody can't taste, they think it's a problem with the tongue.
Yeah.
If they can't balance, they think, oh, it must be an inner ear problem or so. The key is really utilizing different technologies so that we can get a very accurate assessment on how various relay centers in the brain are working.
Yes.
Because when we identify that, then we have a true representation on what's taking place with you.
That's right.
Now you can see with your evaluation, we can see where your weakness is. It's shown up on multiple different technologies.
That's right.
Now it becomes present and aware to you, rather than many people go throughout life and say, I'm good at this or I'm bad at that.
That's amazing. So after this whole process of exercise, you write an outline for the patient and you give them a recommendation of how to improve.
Yes.
And they come here on a regular basis. Can they do them from their home as well?
Absolutely. You know, especially with COVID, we've had to pivot and whatnot. And we, you know, have a boot camp for the brain, if you would, where people come in, and we have a lot of people that come in from around the world that spend a week here.
Yes.
And they're rehabbing all day, and we have people locally like yourself. So people can come through and they could work on very targeted rehabilitation, and we're providing a lot of supportive measures and whatnot throughout that process, and we always retest.
Yes.
There's no point in doing these things if we don't have objective evidence, and that is where the science is key, because if we're not seeing a change, we need to be honest and determine what is it that we need to do differently.
That's right.
All too often practitioners say, well, I get great results, my patients are satisfied. They may be satisfied, but the question is, are we making instrumental change in their function? And the retest is a moment of honesty for all of us, and it's not a bad thing. It's if we're not seeing as much change in one particular area or another, we just need to shift what we need to do.
Right.
But we're very tied to the end product, and the end product is you being well and being at a maximum function and being better tomorrow than you are today.
That's brilliant. Now, Sergio, on that note, you've done so much here in one place. What is your next big dream?
Well, I would say my dream is to make sure.
I know I'll give you a little
Yes,
more wine.
that's
going to
make it a little more.
We always need some.
I would say my dream is really to help as many people as possible so that we can make sure that people are not designing their life, or worse yet, making choices in their life that they have to make and not living their life to their fullest because of their health challenges. We see that all too often.
And how are you going to do that?
One person at a time,
Yes.
in many regards, and additionally, with your help, getting the word out to people on how they can actually be proactive, how they can do things on a proactive level rather than being reactive when their health starts to fail. There's so much that can be done from a preventative basis. Lifestyle changes, diet, nutrition, all of these things are very, very important. And fortunately, the world is embracing that when it comes to exercise, diet, nutrition. But we need to start looking at our brains. We're living longer. Our brain needs to be functioning longer. And there's no benefit, as we all know, to live into 100 if we're drooling on ourselves.
For sure.
As much as we want to extend life, we want to extend function throughout life, and we want to make sure people live the fullest life possible.
And what's your view on this famous topic of life extension?
It's happening. It's not a matter of an opinion. We're living longer than we did. We're living
so
longer
your
than our
goal
parents.
is obviously to make it much better
Make it richer
as
and
far
fuller.
longer we live. Yeah, richer, longer.
Richer and fuller. I mean, we have people in their 90s that are still functioning at a very high level. We have people in their 40s and 50s that are talking about what they can no longer do because their body is failing them.
Yeah.
And I would love to see that entire dialogue change. People should be living their life to their fullest and doing what they really want to do in their life. And we're here to support them. We're here to intervene. We're here to provide many advanced treatments that are not mainstream yet. And fortunately, we're kind of like the speedboat.
That's amazing.
Hitting the beaches of Normandy.
Yeah.
We can shift gears very quickly.
But that's incredible. That's
yes.
why I think it's so phenomenal. The progress of medicine and neurology is insane.
It is. It is. And so the more the brain, the more the world wakes up to the wonders of the brain, the more people understand that your brain is a product of your environment and a product of your life. And there's many things that you can do on a daily basis to improve your function, the better off we'll be.
So on that note, what's your recommendation, a big message to everybody with us today?
I think I've said it, the big message is really to embrace your body being a very dynamic structure, being a structure in your brain, being one of the most dynamic organs that we have. And taking a look at it from a very objective perspective to see where your strengths and weaknesses are.
Yes.
You have to have a growth mindset. Absolutely. I mean, having a growth mindset of looking at your body from a physical and physiological perspective, looking at yourself spiritually and emotionally, and really just pushing the limit. I like to set, goals every year, not at the first of the year. I like to look at my life in review and say, what do I need to do to challenge myself to that next level for this next upcoming year?
And you do that all the time.
All the time. I mean, life would be boring if we did the same thing this year that we did last year.
I could see Sergio was looking at my heart. So I think as an Italian, as a Frenchman, I'm going to give him a portion of my heart. in appreciation so he can wear the JCB jewelry in the future.
Wow.
Wouldn't it be good? So Sergio, in appreciation of today, you have such a great heart for others. This is a little memorabilia of our moment together, and I really want to thank you for this insane day. Dear friends, it was a short version. We hopefully going to do a few more down the road with Sergio, but I really highly recommend not only you call Sergio, you come to his practice, and as importantly as you said, you take care of yourself, you prevent, you measure, you assess with honesty and vulnerability, which is not always that easy.
Well, I truly appreciate it. It's been an immense honor, and this is a testament to you of expanding beyond what you do and what you're so well at to reach out to try to
Thank
make
you.
the world a better place.
Sergio Azzolino!